Hi there, I'm Dre, the host and founder of the Dragon Network. And on this week's video, I would actually like to touch on something that I just recently learned as I was reviewing the 2022 IPPS proposed rule. So IPPS, for those of you that aren't familiar, stands for Inpatient Prospective Payment Systems. And each year, the US government puts out a new rule that outlines the parameters and guidelines that eligible hospitals, critical access hospitals, and long-term care facilities need to follow for that payment year. So the 2022 proposed rule indicates that eligible hospitals and critical access hospitals will have to attest to doing an annual audit using the SAFER guides under the Protect Patient Health Information objective. So what exactly are the SAFER guides? This is what I was actually diving into this week and wasn't as familiar with as I would have liked to be. So SAFER, or SAFER, stands for Safety Assurance Factors for EHR Resilience. So it was developed and originally released in 2014 by a group of system IT safety researchers for the ONC and some other government agencies. And it is basically a structure where there are self-assessments and worksheets that healthcare organizations would work through to determine how close or how far they are with recommendations for safer EHR implementations. So there's 9 different categories that fall into 3 different groups. So today we'll just touch on what those are, very, very high level about what each sort of purpose is. So I'll put some links in the comments below so that you can actually link over to the self-assessment tools and check out the worksheets. The 3 main categories that they fall under are foundational guides, infrastructure guides, and clinical process guides. So there's 2 separate areas within the foundational guides. So high priority practices, which really focuses on the big overarching social and technical recommendations to have a safety first and a safer EHR implementation in place. And organizational responsibilities, which really looks at the processes, the activities, and the tasks that are required and need to be in place by an organization to actually ensure that you have a safe and effective EHR within that organizational entity. So this one does focus a little more on the social behaviors and human interactions that are present in an organization, and it also involves individuals who are responsible for patient safety. So there is a broader group of people that are involved in ensuring that these recommendations or what's outlined in the self-assessment are actually carried out. So there's 4 basic principles that the organizational responsibilities also align with, which is different from some of the other areas. And they are activities to optimize EHR quality and data quality within the organization, activities to ensure that EHR is preventing safety hazards, activities to ensure that EHR information is available, and activities to help the organization learn from the EHR efforts that are put in place to reduce those safety hazards. So before we continue with the other 2 groups, I just want to show you quickly what the self-assessment guides actually look like and how they would be completed. So if you'll see, there's recommended practices and they're broken out by domain for each of the area that's listed. So the one that I have up on the screen right now is for high priority practices. And really it's a checklist where there are items within a domain and the organization will indicate for themselves whether they adhere to the recommendation fully in all areas, where they have partially implemented that recommendation in some areas, or whether that's not yet implemented and they need to continue to work on developing something like that for the future. There are worksheets that are also attached to each. The worksheets indicate what the recommendation actually is, some places for you to put notes, as well as some of the research and some of the information that has gone into making the recommendation and what some of the risk factors associated with that recommendation are. So let's jump back over to the next group, which is going to be the infrastructure guides. So within the infrastructure guides, there's 3 different areas that contain recommendations or these self-assessment tools, and that is contingency planning, which is really focused around all of the activities, practices, and processes that are going to be necessary in an organization to help mitigate and manage any EHR unavailability, whether that be a planned unavailability, such as a scheduled downtime, or an unplanned event, such as a major incident that results from a network failure, some sort of slowness, or barrier to use that is in place. So anything that focuses around that. The next one is system configuration. So this actually focuses on anything that is required in order to ensure that the EHR is set up and maintained from a configuration perspective in an appropriate way that is going to promote safety and safe practices. So it is talking about things like making sure there is appropriate documentation, that testing is done, that you have the right individuals engaged throughout the design process, things like that. So really everything that focuses around the activities associated with your clinical applications group is going to fall under this recommendation, or is going to have sort of some factors and domains within here. The next one is system interfaces, and this is focusing on the activities, the tasks, the processes, and the structures that are recommended around ensuring that the system to system connections for anything that the main EHR is connected to are actually set up, functioning, and being maintained in the most appropriate way. So it looks at things like ensuring that you have common standards in place for the organization so that you aren't sort of relying on translation tables and things like that, making sure, again, that testing is done, putting in place rules around sort of what can connect, when it can connect, how it needs to be monitored, that type of stuff. So that self-assessment is really about all things integration and focuses on the interoperability aspects. The next area that we have is the clinical process guides. And the clinical process guides, there's actually 4 areas that fall within this one. They are patient identification, which focuses on the core recommendations or the series of recommendations that are going to ensure that you have the right patient identified at the right time and in the right place, and that that identification is reliable. The next one is going to be CPOE with decision support. So anything that is focused around computerized provider order entry, as well as your CDS alerts, or any of the logic that is put into algorithms that are being utilized by that EHR. Some of the things inside of this particular area include things such as making sure that the organization has a review process in place, making sure everything is clearly outlined, updating the literature that's supporting your CDS, making sure that your CPOE is based on best practice, things like that. So the next one is test result reporting and follow-up. And this really focuses on anything that's in place within that EHR to promote safety and safe practices around results, how they're received, how they're communicated, if there's alerts in place, things like that. Anything to do with having test results come back and the follow-up processes that are required for those test results. So the last one is clinical communication, and this is really focused on clinical communication between clinicians. And there are 3 different areas that it focuses on with the recommendation, so the domains are broken down. And that is consults and referrals, so what that communication path looks like, discharge-related communication, so how discharge planning and all that kind of stuff, any recommendations and safe practice guides and implementation activities that should be in place to support discharge communication. And the final one is patient-related communication between providers. So really, I would highly encourage you, if you are working in an organization with an EHR implemented, which I think probably is most of you, to take a quick look at these safer guides. I found them actually very interesting, and I think they would be incredibly helpful for organizations to go through. They are similar to some of the other assessments that are out there. So there's certain questions within each of the guides and within each of the areas that are addressed in other self-assessment tools or would be addressed with regular organizational practices, but having them all sort of written down in a list I found to be quite helpful and sort of made me think of a bunch of things that I hadn't really thought about in a long time. And I think doing the annual assessment, so I don't know if it will end up in the final rule, but I think just suggesting it, some organizations may want to do that anyways, whether it's in the final rule or not, because it may be helpful sort of to understand which areas they're lacking in or where they need to put focus. So these safer guides are available online. I am going to link to them. They have been updated since they were released, and it is anticipated that they would be updated as more safety information and as more best practice and implementation information becomes available. They are also very clear, the ONC is very clear on the website that they are not meant to be sort of legal guides in any way. They are recommendations, they are self-assessments, they are meant to be used as workbooks by the organizations, and you're really supposed to sort of derive your own activities off of those. So implementing everything that's listed on that recommendation list will not guarantee that you're going to be HIPAA compliant or that you're going to meet all the rules of IPPS or anything else. the interoperability and patient access rule, it doesn't actually focus on that. It's more of an overarching sort of thought process and exercise to understand, do we have everything in place and are we following sort of industry guidelines and industry recommendations on what we should have as an organization to make sure our EHR is safe. So thanks for tuning in this week. I hope that was helpful. Again, I have just started learning about the SAFER guides. I apologize, I didn't know much about them before, and I'm not sure why I haven't come across them, but I haven't until just recently. So I thought I would quickly share sort of what I've learned so far. If you do know more about them, or if you're from an organization that does currently follow these, let me know in the comments. And I look forward to continuing the conversation on SAFER guides inside the Dragon Network. So if you're interested in learning more about what we do inside there and how those conversations can sort of form, then I invite you to check out network.dragon.com and join us for a free trial. I will talk to you again next week. I hope everyone has a great day.